begin.
Hello, this is our over-the-counter medications for allergic rhinitis. I am Joelle Tshikuta.
I'm Ovais Khalil.
I'm Lawrence Kuipers.
And I'm Shannon Pfau.
So what is allergic rhinitis? Also known as hay fever and also colloquially known as seasonal allergies. This is when allergens like pollen, pollution enter the nose, and it triggers an immune response, an inflammatory immune response to be certain. So those cause sneezing, running nose, congestion, itching, burning, discoloration in the mucosa, and nasal polyps. Next slide, please. So in order to treat because it's such a common occurrence, usually people do not take drugs for it. Usually there's a lot of non-pharmacological methods. One, nasal rinses, avoiding the allergy. If you're allergic to pollen, you avoid pollen. You take measures to reduce the allergen, steam showers, hot compresses, acupuncture, and nasal ointments. All these are good non-pharmacologic treatments. Next slide, please. But let's talk about the pharmacologic treatment. First of all, there's nasal glucosteroids. Now, these work by disabling the antigen to antibody mechanism and reducing the reaction of the antigen-antibody system. So this reduces mast cell granulation. We know that mast cells are really responsible for releasing those inflammatory cytokines and making an immune response. Now, I have here a list of over-the-counter nasal glucosteroids. And a lot of these we've seen commercials for, Nasacort, Flonase, Astepro. But if you've, so we've all probably seen a lot of commercials for these. These are very good drugs, but they come with some adverse effects that include irritation, bleeding, septal perforation, and something that's kind of unique called suppression of the hypothalamic pituitary axis. Next slide, please. So things to know about this drug. So they do interact with cytochrome P450 3A4 inhibitors such as rapamycin and erythromycin. And what that can do is increase the concentration of the glucosteroids. So that could do things like raise blood sugar, cause a lot of other issues. But there's actually very low interactions with these drugs just because it's there's low systemic absorption. There's things to consider though. One, pregnant patients should talk to their doctors before taking these medications because it does cross the placenta, but however, there's low systemic absorption. So I'm not saying don't take it, but definitely talk to your doctor. And also, they can suppress the hypothalamic pituitary axis, and that can affect growth if taken long term. So they shouldn't be used long term in children. But however, this is a very rare effect. In my research, I couldn't find any time this actually happened.
Okay, the second line of therapy is antihistamines. The antihistamines compete with histamines for receptor sites of the effector cell, thereby blocking the histamine-mediated response to the allergen, which causes the symptoms of congestion, runny nose, and sneezing. The subclass of antihistamines, H1 blockers, which specifically block histamine at the H1 receptor site. I have listed the over-the-counter options, forms, and dosages they come in. This includes Benadryl, which is first generation, and then Claritin, Zyrtec, and Allegra, which are all second generation. And then there's Xyzal or levocetirizine, which is third generation. Many of these antihistamines have similar adverse effects like dry mouth, somnolence, headache, fatigue, and dizziness. Benadryl has the most sedating effect as it is a first generation antihistamine. Drug-to-drug interactions. There are many drug-to-drug interactions located in micromedics for this drug class, but here I have highlighted the most important. Benadryl is contraindicated if the patient is also taking MAOIs, as they may further increase the anticholinergic effects. Oxybates due to CNS depression, and potassium citrate, which may cause GI irritation. Claritin or loratadine is contraindicated if the patient is taking amiodarone because this may increase the risk of QT interval prolongation and torsades de pointes. Zyrtec is contraindicated if the patient is taking any other CNS depressants. And then Xyzal, the levocetirizine, this has the same drug-to-drug interactions as Zyrtec. And then Allegra is contraindicated to concurrently use with levoketoconazole and pitolisant. All right, special population considerations for Benadryl. Benadryl meets the Beers criteria to use with caution or avoid entirely in the elderly population. This is due to the sedating and anticholinergic properties. Also, do not use in breastfeeding patients or premature infants. And then also do not use in patients with increased IOP or glaucoma. Also contraindicated in men with BPH, as this may further decrease urine flow. And for Claritin, use caution in renal and kidney impaired patients by giving the same dose, but every other day. Also only used during pregnancy if the benefit outweighs the risk. And then for Xyzal, use with caution in patients with renal and hepatic impairment. Do not use in patients with ERSD on dialysis and pediatric patients 6 months to 11 years with renal impairment. Then for Zyrtec, again, use caution in patients with renal or hepatic impairment. Give 5 milligrams in adults and not recommended in children with creatinine clearance less than 10 milliliters per minute. Allegra, do not take within 15 minutes of an antacid containing magnesium or aluminum, which will decrease absorption due to the binding of the drug. Do not take with fruit juices such as apple, grapefruit, or orange juice, as this will decrease the absorption and bioavailability of this medication. Okay, next is decongestants. These work by acting on the alpha adrenergic receptors, causing vasoconstriction of the nasal vessels. And then oxymetazolin's effects are local as a nasal spray, but the phenylephrine and pseudoephedrine effects are systemic. Adverse effects include headache, insomnia, dry mouth, somnolence, nervousness, dizziness, fatigue, anorexia, thirst, but the more severe adverse effects are hypertension, decreased cardiac output, and heart failure. And then for drug-to-drug interactions, phenylephrine and oxymetazoline are contraindicated in concurrent use of MAOIs, vasopressors, non-selective beta-adrenergic antagonists, and this is due to the sympathomimetic activity. In addition to these, oxymetazoline is also contraindicated with tricyclic antidepressants. And then special considerations due to the alpha adrenergic agonist effects of phenylephrine and oxymetazoline, use extreme caution and monitor closely in patients with severe cardiovascular disease, as decongestants, especially the oral ones, can have an effect on life-threatening effects on blood pressure and cardiac output. And this can worsen CAD and heart failure. Also allow 14 days between discontinuing MAOIs and starting phenylephrine or pseudoephedrine to avoid potential hypertensive crisis. And then also phenylephrine is not preferred in pregnancy.
So although over-the-counter medications are generally considered to be safe and the risks tend to outweigh the benefits, it is important to consider different safety issues related to these medications. Antihistamines, for example, it's more common to see these adverse effects in the first generation antihistamines. Diphenhydramine especially has a higher side effect profile. More people experience these side effects. And it's really important to consider patients with thyroid problems, high blood pressure, coronary artery disease, congestive heart failure, BPH, glaucoma. as these patients may especially experience adverse effects. Corticosteroids are usually dose dependent when regarding adverse effects. At higher doses and longer duration of treatment typically causes more side effects. Decongestants are similar, especially with phenylephrine, which can cause decreased cardiac output. So special consideration is really important in patients with coronary artery disease, hypertension, once again, thyroid problems, BPH. Next slide, please. Some other safety issues to consider are adherence. Patients are less likely to adhere to these medications if they are experiencing adverse effects. Lower socioeconomic status, lower education levels, social and financial burdens may be reasons for patients not adhering. So it's important to consider that when deciding on a treatment regimen for your patient. Rhinitis medicamentosa is also an important consideration where patients may be using nasal sprays too often, and this can cause chronic inflammation of the nasal sinuses, cause atrophy, septal perforation. But if patients discontinue these medications, they can usually make a full recovery in 1 year. In order to prevent these adverse effects, it's important to educate your patient, make sure they're taking their medications as recommended. Consider second generation antihistamines or even third generations, and make sure that they know that short-term use is usually for the best. Next slide, please.
So although allergic rhinitis although most people with allergic rhinitis can use over-the-counter medication with success, there are some options where those over-the-counter medications are not working and they need to get prescription options. So a couple of examples of prescription options are like leukotriene modifier, for example, Singular, Zoloft, and then for glucocorticoids, there is prednisone, Symbicort, and then we have things like antihistamines, Clarinex, which can kind of be confused with Claritin, but this one, the Clarinex has to be prescribed. And then decongestants like ephedrine and pseudoephedrine. So the reason why these things do have to be prescribed because they do tend to come with more side effects, and then long-term use of them can cause potential problems in the future. For example, prednisone. So they do have to be the patients do have to be monitored a little bit more than the over-the-counter options. Next slide. And then for the cost of these, so these medications, the over-the-counter medications are generally very affordable for most people. So with the cost, I kind of just went ahead with CVS for all the medications to kind of keep it the same across the board, because every store does have different prices for things. So with the Benadryl, it is $6.99 for like a 24 tablet. This is that CVS. For Claritin, it is $7.99 for 5 tablets. And then you move on to like corticosteroids, like Flonase, $18.79 for 72 sprays. Sudafed, which is $16.49 for like 20 coated tablets, and this is the max strength. And usually with this, patients can make a full recovery without having to go back and like buy more. So like most of these bottles, like they can just get like one bottle or like one 24 tablet thing and they'll be fine. Next, please. So this is just a list of all our references. Thank you so much